Hi everyone, my name is Dr. Bisma from Dr. Ducu Clinics. We're here at the first day of ACE. Another year, another ACE. Shall we go inside? So today we are here inside now. We're going to have a look at some of our providers and speak to them, ask them about their industry insights so that you can know more about the aesthetic procedures that we do. Dr. Bisma from Dr. Ducu Clinics, it's nice to meet you. So Andrew here is one of the faculty members at DermaPen. We're just going to be asking him a little bit about DermaPen and how it works and just get his opinion. How are you today anyway?
I'm doing really well, really well.
Perfect. So first I kind of want to ask about the DermaPen itself. So microneedling, for those people that are new to aesthetics and don't know it very well, can you tell us briefly what is microneedling and what are its benefits?
Microneedling is an amazing treatment. It's like one of the only anti-aging treatments clinically because it creates a wound which our body does naturally through the healing process. So it's originally was utilized specifically for collagen induction, so producing 1 and 3 collagen. But with DermaPen especially, now we've opened that up a little bit so we can use the channels to implant now as well. So not only do we produce collagen, which is of course anti-aging, we also want to help support things like rosacea and acne, pigmentation by the application of active ingredients through the open channels.
Okay, that's very interesting. And with that in mind, would you say there is a certain cohort of patients that find microneedling with these kind of things beneficial? Like, is there someone who it's not very useful for? Who are the patients that would really benefit from microneedling? What age would you say?
Well, if I'm honest, everybody really, because even if you're younger, you're still going to grow older, right? So even if you're younger, you'll do a very superficial treatment and that will go into the open channel, bring in those products. So we're going to get like the retinols, the vitamin C's, the vitamin B's, D into our skin to help maintain that consistent regeneration. But of course, as we progress through age, they'll probably be the ones with the most prevalent, the ones that are into it more because they want that collagen production, which has been lost over time. So it really can fit into any age category and also the indication side of it. So you've got a younger patient with acne, perfect, pigmentation, menopause, melasma, hair loss. So it could be across the spectrum when it comes to age.
Okay, across the spectrum. And you mentioned one really beneficial one as well, hair loss, which a lot of people are suffering from nowadays. What would you recommend would be, like, let's say with DermaPen, the best kind of combination treatment to do for hair loss?
Well, medical needling, as you're fully aware, kickstarts cytokine and androgenesis. So as a standalone treatment, it has a great ability for hair loss. But we're now using biomimetic human relationship exosomes. So that can work in accordance with not just androgenic, but from female pattern baldness as well, of course. But then again, back to the menopause, diet, weight loss medication, all the things that are not helping with the hair loss process. So we're using, again, the needling as a kickstart from the androgenesis part of it, but also the channels to allow the products in deeper to really do their job and to support this at home, because they do need to do this forever, like in any hair loss regime.
I think I agree with you on that one. And hair loss is such a big thing that I feel like a lot of people are currently going through, especially living in London with hard water. It really makes people lose a lot of hair. So that is one thing very useful. I think lots of patients would love to hear more about that. From your point of view, what would you say is the biggest thing that's coming into aesthetics? Where are we moving in with the kind of exosomes you mentioned as well? Is there anything else that you see that's emerging right now, especially with DermaPen?
Do you know what? It's going backwards. And I love this. So I think all the newfangled things that people are trying to like change up the industry, bringing new and innovations in, it's going backwards. It's going back to true regenerative medicine. It's going back to basics. Like needling has always been a starting point, but things like mesotherapies, true acid peels done correctly now. Devices that could do multi protocols in one go, like the new Synergist. So all of this, it's like supporting the skin from a regenerative perspective rather than a instant gratification.
And I think that is very beautifully put. That I think we're going back to the basics, back to square one, where we're trying to bring our skin back to how it used to be rather than trying to push new things into it. But I think definitely the ingredients that you're using do help, the ones that Dermapen produces as well. What would you say is your most recommended treatment from Dermapen just for overall collagen induction?
I use one of the products called MHA 35 Plus, which is this cocktail of gorgeousness. Like, it's got retinoic acid, it's got vitamin C, it's got hydroxyapatite, calosomes, so all these incredible ingredients, and all we're basically doing is making those beautiful channels, allowing that product in, so the consistency and longevity is happening from the skin health perspective, but the needling is helping from a collagen perspective. So we can do the treatments of maybe 6, which is the collagen reduction, maybe slightly deeper, a little slightly more trauma related, and then we change that into more superficial to keep those products doing their job.
Yeah. Well, that sounds like a very powerful house of ingredients. Thank you so much, Andrew, for your insights.
My pleasure.
And I will hopefully catch up to you at another time as well.
Yes, look forward to it.
Thank you.
Thank you.
My name is Dr. Bisma. It's nice to meet you.
Nice to meet you.
I've got a little microphone here as well, so we can do a little bit of a talk. So tell me about your products. I'm seeing something about regenerative, which kind of caught my eyes as well. Can you tell us a bit more?
Yeah, I will tell you a bit more. We invite you to our lecture. It will be 10 past 2. Sorry, to 10 past 2. Yes, it's correct. So, but I will tell you a little bit. It's a system. So the Make Regenerated will be the system to rebuild your scaffold, but in a different way. So we use PCL, but the PCL is a liquid formula, pharmaceutical one. So we base on the signal for alpha-1 chain, because we collect alpha-1 chain from the silkworms, because it's ours. We put a small piece of our DNA, of collagen DNA, to the silkworms, and then we collect the collagen for our product.
Ah, okay. So it comes from each patient, is what you're saying. So it's autologous?
From the human, because it's 99.9% the same like ours, because we put the DNA to the silkworms and they produce our collagen. But in this product, as I mentioned, we just only use one chain to stick to our fibroblasts. So we give the signal to our fibroblasts to grow. Hi guys, we need more elastin. Hi guys, we need more collagen.
Okay.
So we give one chain, and in the same time we give amino acid, because they need a fuel. So the fuel will be amino acids.
Amino acids and collagens, these are really important things generally for patients, especially when it comes to aging.
And for natural look.
And for a natural look, which is what a lot of patients are going towards as well, as you
Exactly.
said. So tell me a bit about how the treatment works. Is it injectables? How often do patients need to do it?
It's injectable, but I don't mention about CMC. It's a gel.
Ah, okay.
So this gel will be crucial part because it's injectable. And I will show you.
Okay. Can I have a look?
It's ready to use if you like to see. Yes,
Oh,
of
okay.
course.
Yes.
Especially for you. Even today I saw the first time
Oh.
the syringe. So feel free to see as
So
well.
this is a brand new product?
Yeah, that's we are launching today.
Oh, they're launching today?
Yeah, launching today. It's really fresh one.
Okay.
So we put all those things inside with the gel. And this is a crucial part, because we need to go how many times we need to do it.
Okay.
But when you go to our lecture, you will find a bit more about all the process, because now we provide signal. We don't have an inflammation. So back to nature. We control of the process. So we have a guard, PCR guard, which release that kind of product in the specific, precisely time what we have.
So would you say, because there's no inflammation involved, that there's very little downtime with this procedure?
Yes. So we use the cannula. And after we use cannula, in the same day, we have hydration effect and glow effect after CMC.
Now that I think a lot of patients will love to hear,
Yeah, I
because
know.
a lot of the collagen induction that we normally see involves inflammation. So patients have a bit of downtime. You have to be out of work, or you.
control the process.
Yes, we don't control the process.
You don't control the process, and in this case, you control the process because you have a different. Still, you got a simulation, PCL, but in liquid formula. So it's a different one. You put everything inside to precisely know what time we should take from this.
I love this.
yeah.
This sounds like a very interesting treatment, and I'm very looking forward to it.
Yeah, you really.
Yeah.
You will, as you can imagine, you will see the results in a few minutes. In the second round, you will see more.
Okay. Well, I think what we'll do.
First, you need to go upstairs, listen to Dr. Jamal, and come back. Tell me your feedback
Okay.
because it will be crucial.
I think we will do that then. Yes. 2 o'clock. Here we go. Thank you.
So we've had a discussion about this new product that's coming on to the markets hopefully soon. And patients have seen some really good results with it. The main concept with it is that it uses signal modulation in order to improve the collagen production and the elastin as well, which helps to recreate the extracellular matrix that we tend to lose with age. Now it uses a couple of components, including alpha-1 modulation, as well as an amino acid complex and bioactive PCL, so it doesn't use microspores, which traditionally can cause granulomas. So these are all really innovative and new things, which I'm looking forward to seeing, and hopefully we'll see some results with it.
So now I'm here at the InMode booth with the Ignite device. Now this device is a really integral part of our clinic. We primarily use it for our skin tight protocol treatment designed by Dr. Ducu. So what that involves is a combination treatment. One of the biggest parts of that combination treatment is using the Ignite device for radio frequency, which primarily aims to help tighten the skin and remove any fibrosis as well present. So we do that on a lot of patients that have had liposuction primarily, or those that are suffering from loose skin, whether that's postpartum or just from general weight loss or aging as well. So if that's something that you'd be interested in finding out more, you can talk to us about it. But also, on top of using the Ignite for the skin tight, we also use it for the Morpheus 8, our traditional Morpheus 8, which comes with a variety of settings that we use. Its main use again is for skin tightening, but it also helps with collagen induction. It helps with skin tone as well as skin brightness as well. So it's got a myriad of things that it can help with. And if you're interested in finding out more, just contact us at the clinic. Nice to see you again. So, Gina, it's been a long time. I want to find out a little bit more about what's going on with InMode at the moment. Tell me, can you tell me a little bit about what's going new, what you've got going on?
Of course, super excited that you guys are here and that you're asking about the latest with InMode. So as you see here in front of us, we've got the Ignite device, which basically has the quantum RF technology, which you guys
use as well, yeah.
have in clinic and use a lot when it comes to skin tightening, fat reduction, anything that has to do with minimally invasive procedures. You can see here as well the latest version of Morpheus 8. So this is the Morpheus 8 Burst.
What's different about the latest version, I want to ask?
Okay, so a few things. It's much faster in terms of the treatments that it does. It's safer because it drops the energy when the needles go up to the surface, and it's more effective. So the way the energy is dispersed is much more effective. So it gives you basically better results.
Patients would love that.
Patients would love that. It's less painful, of course, because there's a pain element sometimes with Morpheus 8, as you guys know. So this is an upgraded version of Morpheus. So yeah, this is the Ignite, which you guys have. It's got the quantum for the face and for the body, as well as the Morpheus 8 face and body. Do you want to see the other ones?
Let's have a look at the other machine.
Okay. This one could be busy, so I'll show you guys the latest one, which we've got here. That's the latest device that we're excited about at the moment. It's a Pico laser. So the device is called Pico 5 by InMode. And we've got two different wavelengths. So we've got a 1064 and 532 wavelengths. And it's specifically designed to target everything that has to do with pigmentation, melasma, even tattoo removal. I mean, again, it's a massive indication that potentially patients would need.
Yeah,
so I have a tattoo I want to get rid of, basically. So I can't wait to get mine done.
Things you did in the past, we're going to remove them
Exactly,
now.
yes. Regrets, basically.
Okay, that's pretty cool.
But yeah, this is a Pico laser. And then you've got the Optimus Max.
Oh, the Optimus Max I've not heard of before. What does the Optimus Max do?
So this is our aesthetics device. This is our purely aesthetics device that has Morpheus 8, but it also has IPL.
IPL laser as well. Tell us about IPL. What is IPL and like what benefits does it do for the skin?
So IPL is basically intense pulse light, and it's a wavelength. We've got a peak power in its wavelengths at 500 to 600 nanometers. It's specifically designed to target rosacea, pigmentation, everything that has to do with the skin tone, especially on the face and neck. I would say, obviously, now that we've launched the Pico laser, the main difference between IPL and Pico is that the IPL is limited to skin types up to 4.
Okay.
And it cannot do body, whereas the Pico can do everything.
It can do everything.
And you've got no downtime, no risk of PIH, whereas with the IPL, of course, you have to be a little bit more cautious when you're doing the treatment.
Yeah, so no holidays, guys.
No holidays here. Yeah, when you come back from holiday, I wouldn't recommend this
Yeah,
one.
no IPL after holidays, but Pico, you can definitely do
Pico is
after
very
holidays.
safe. You can do scars, you can do everything that has to do with, pigmentation and PIH. So yes, that's our third device. And then the one there is
Shall we walk down there? Yeah.
Yes,
Let's
sure.
walk down there. Come.
Sorry.
It's okay.
So you've got our intimate health
Intimate health now as
device.
well. Okay.
Yes. This has basically got the Morpheus 8V,
Okay.
which is basically microneedling but for the V, vagina.
Ah, okay. So intimate health.
Intimate health, and this is phenomenal. Honestly, when the company launched it, everyone was so worried that you're going to find it really painful, and
Yeah. Almost.
when actually it's not. I mean, we give birth, down there, so usually something like this is not that painful around that area. We still numb the patient with it, but again, it's phenomenal when it comes to laxity, prolapse, urinary incontinence, pelvic muscle floor weakness as well, because it's got an EMS, electric muscle stimulation feature with it as well.
So it's like doing lots of Kegels, isn't it?
Kegels as well as skin tightening, so RF internally and externally.
Love that. Okay, so that's very interesting as well. So we're not just focusing on our outer health, we're also looking at inside as well. So that is lovely to hear as well.
Exactly.
And what else have we got here?
And then we've got our dry eye solution platform. So
Oh.
this is basically called the Envision. And you've got the Lumeka eye, which treats basically, it's an IPL that you can use around the eyes.
Around the
And
eyes?
then- yes. And then you've
Okay.
got Forma eye. So you've got an IPL for the eyes and then RF for the eyes, and that's specifically designed to treat dry eyes.
That is lovely. There are a lot of people that suffer from dry eye conditions, so that's
Exactly.
really interesting to know. I feel like this is something that I don't see a lot of other manufacturers having actually.
Very niche.
Very niche indeed. Okay. So along with treating because we have a lot of injectables. I see everybody has injectables, but no one really treats like around the eye area in terms of dry eye. So that's really good to
And
know as
everyone's
well.
got dry eye. Actually, 80% of the population actually has dry eye.
Dry eyes. Yeah, I
it's
definitely know.
such
I
a-
have them. Contact
We all do,
lenses.
honestly.
Of course. Well, that is
but yes,
amazing.
this
Well, tell me, what is the main thing that you would say is something that a lot of patients kind of look over and would be very beneficial for them, like out of everything that you've mentioned?
I mean, right now, you guys probably know this. Quantum is the top seller at the moment because we've got a lot of GLP-1 patients that have gone through a massive weight loss journey.
Yes, so
Have a
everyone
lot
that's
of-
been using Manjaro and Ozempic, yes.
Exactly. Mounjaro and Ozempic, lax skin, that cannot be, there's nothing you could do for skin laxity, and this is where the RF is phenomenal.
Really
This is where you get in with the quantum RF. I would say, of course, the IPL aspect that treats pigmentation as well as the Pico laser are the next best thing
The
as
next
well.
best thing, yeah.
And of course the Morpheus 8, which is still our bread and butter. It's phenomenal when it comes to skin texture, acne scars, tightening. Everything has to do with skin really from head to toe. So
Perfect.
that's
That is amazing, phenomenal. Thank you so much for all that
Pleasure.
information.
Thanks for all the
And we look forward to catching up to you again. I'll probably catch up to you somewhere else to this week.
exactly. I'll
Yeah.
bump into you somewhere for sure.
Oh my god, thank you so much. That was phenomenal. Now we're at the Cyton booth next to the BBL laser, which we also have in clinic. Now this laser is useful for a variety of skin concerns as well, primarily for photo aging, but it also helps with things like pigmentation, redness, rosacea, and also a bit of inflammation that you see with acne as well. So it's got a multitude of indications and across the ages as well. I think it's also recommended for everyone to do it because it helps primarily with that one thing that we're all looking at, which is regenerative practices, bringing back more collagen into the skin. So this is one amazing way of doing that, and it's very quick. You can come in during the lunchtime to do the treatment. It's not very painful. You'll just have a bit of redness, maybe as a bit of downtime, but then after that you'll be good as new. That's a wrap for day one of ACE. We got to talk and ask some questions to some of our key providers here. I hope you guys found that information really helpful in understanding a little bit more about aesthetic treatments and what we have to offer at Dr. Ducu clinics.